Okay. Welcome, everyone, and thank you for attending today's special briefing. As you well know, the governor announced today the blueprint for a safer economy. This blueprint is intended to reduce COVID-19 in the state with revised criteria for loosening and tightening restrictions on activities. The blueprint for a safer economy replaces the county data monitoring list for determining what businesses can and cannot open. If we can go to the next slide, the focus will now be on case rates and percent of testing positivity. And in this particular slide, this is the state of California and shows the what tiers all respective counties throughout the state are in. Widespread is the most severe or strict tier, which is tier 1. Substantial or red is tier 2, moderate is tier 3, and minimal is tier 4. So the most restrictive tier has the lowest number, and the lowest risk level has the highest number. And as you'll see in the bottom, the county of San Diego is red, surrounded by a sea of purple there. And the other urban counties are in Northern California that are also in the red, and this includes San Francisco. Now in this next slide, this is the old state monitoring list. The state is pulling out case rate and testing positivity. Those are the two that are circled, and all of the others will continue to be followed, but for the purposes of the tiers, these are the primary two measures that will be followed. Now, San Diego was calculated, if we can go to the next slide. This is the tier system: widespread, which is purple; substantial, red; moderate, orange; and minimal, which is yellow. And case rate will be calculated in a different way than the case rates were calculated before. Previously, case rate was calculated with a 3-day lag and then the prior 14 days. Now the new calculation is a 7-day lag and then the prior 7 days. And this will be a one-digit number, so you can see for widespread, it's going to be more than 7, substantial 4 to 7, moderate 1 to 3.9, and minimal less than 1. For test positivity, that is unchanged. If we go to the next slide, this shows where the results are for San Diego. So when the state calculated our metrics and determined our placement or status in the tier system, our case rate was 5.8, which landed us in the red tier, or tier 2. When calculating the test positivity, it is 3.8, which is the orange or moderate level, but given the fact that one of the two is in a more strict tier, that is the tier that a county would be placed in. So hence, San Diego is in tier 2, which is the red category. Now, next slide. At a minimum, counties must remain in a tier for at least 3 weeks before moving to another tier. The county must meet metrics for the next tier's 2-week period before moving on to that tier. Counties can only move one tier at a time. You can't jump a tier. Metrics will be assessed weekly, and the state will report results weekly on Tuesdays. And in the next couple of slides, I want to review what sectors will now potentially be allowed for San Diego. This slide shows that restaurants, dining in, places of worship, movie theaters, and museums are now allowed to conduct indoor operations with modifications. And modifications mean those non-pharmaceutical strategies like washing your hands, using face coverings of social distancing, and staying home if you are sick. And this is with a 25 percent capacity, or 100 people, whichever is less. So we are not saying that these sectors can open up 100%. This is only at 25% capacity, which is the capacity that that facility has been assigned. So let's move on to the next slide. Gyms and fitness centers are allowed to conduct indoor operations with a maximum of 10% capacity. Hair salons and barbershops and nail salons will be allowed to operate indoors with modifications. And in the next slide, as a reminder, this new tiered system and opening of indoor operations of businesses with modifications will be effective this coming Monday, August 31st. Also, just want to also remind people that the reopening of schools K through 12 is not impacted for San Diego County by this new change. Monday, August 31st will be day 14 since coming off the monitoring list, and K through 12 schools can open on September 1st if they choose to do so. This slide also, if you need to get more information, you can simply go to the state's website at covid19.ca.gov. You can put in San Diego and look for the various activities, and it will provide you that additional information. Now, keeping up the momentum to stay on track and not go backwards in this new tier system to the purple tier will require that all of us follow the best practices or non-pharmaceutical strategies that we've been talking about every day in our news or media releases and every time we have a media briefing. These include washing your hands and promoting sanitation practices, staying 6 feet apart from others unless they are household members, wearing a face covering, avoiding crowds, and staying home if you are sick. Now, only by being vigilant with these strategies will we be able to maintain our current Tier 2 status or advance to a lower tier, which is Tier 3. In closing, I just want to be very clear that the more people follow these strategies, the better we will be. But if people do not follow the rules and the strategies that we continue to share with you, the greater chances are that we will advance to Tier 1, which is the purple tier, and will go backwards and be very close to where we were in mid-July before the state imposed restrictive measures on counties across the state. So with that, I would like to end my update and take any questions. Thank you.
The first question we have is from Paul Sisson with the San Diego Union Tribune.
Hi, thanks for taking my call. I have a couple questions. This is all very sudden, so we're still trying to digest it. My first has to do with retail. The new tiered structure indicates that the purple tier can only operate at max 25% capacity, the red tier at 50% capacity, and then the subsequent tiers, I guess, at 100% capacity. What is going on in retail right now? Aren't most of our retail establishments currently operating with really no controls on what percentage of their square footage they can use?
Well, right now, if you can enter a retail entity from outside as opposed to that retail being inside a mall, if you can enter from outside, they are open. But I think this is makes sense because what we're trying to do is there are some outbreaks that we see in retail. So by decreasing the capacity, this will help with increased risk and increased exposure.
Okay, Dr. Wooten, so you're confirming that this is a more restrictive change than we currently have for retail. We're going from 100% currently if you have an outdoor entrance down to 50% here in San Diego County since we're in the red tier.
We are following what's on the website, Paul, as it relates to what is being recommended for Tier 2, which is the red tier.
Okay. And in terms of the calculation of case rates and positive rates, I know that the previous case rates used something called the episode date rather than the reported date. Is that still going to be the case? Would it still be using the episode date?
Yes, that will still be the case. The difference between the old case rate and the current, or the new case rate as of next week, is that instead of it being a 14 or 3-day lag and then 14 days, it is now a 7-day lag and then that prior 7 days. So that's why the numbers are distinctively different.
Gotcha. And, you know, the governor said today that local health officers, such as yourself, are able to be more restrictive than state guidelines. As you take a look at what came out today, do you have any desire to be more restrictive than some of these that the state has specified?
Well, thank you for that question, Paul. Obviously, we are all concerned about this. Again, this is trying to strike a balance between economic viability and protecting the public's health. This has just come out today. It's been approximately 3 hours, and we will be assessing and looking at everything that has been placed on the website. We didn't have any participation in that information before it was posted. So we will be looking at if there is the need to be more restrictive. I just can't tell you what that will be today and right now.
Okay, one more if I may. In terms of calculating these new rates, it says here on the state website, case rates include an adjustment factor for counties that are testing above the state average. I guess that's a testing in terms of number of tests performed. Do you know if we have an adjustment factor here in San Diego that's being applied?
Well, if counties fulfill that criteria, all counties will have the adjusting or adjustment factor. So again,
Can you share with me what that is?
oh, they will for each tier they will tell you what it is. I don't have it memorized yet, Paul, but we will.
Okay,
yes. When we report that, we will include that in our report out. This report is not daily now, as we have been doing previously. The state is recommending or will be conducting weekly reports, and they will occur on Tuesdays on a weekly basis.
Thank you.
Thank you.
Our next caller is Artie Ojeda from NBC7.
Hi, Dr. Woodman. Thank you for taking my call. You talked about some of the restrictions on some of the facilities, the modifications, gyms, 10%, restaurants, houses of worship, 25%. Can you tell me how those new restrictions are going to be enforced?
Thank you for that question, Artie. We are very cognizant of the fact that this is going to require enforcement, and luckily we have a compliance and a team that will be working on this. But I would like to invite to the podium Gary Johnston, who is our Chief Resiliency Officer and works very closely with our compliance team.
Thank you, Dr. Wooten, and thanks for the question. Great question. Again, Gary Johnston, I'm the lead for some reopening here across the county. The first thing that I would like to tell everybody out there that's going to basically look at going back indoors is that if you have it, you will have to have, as you have had, a safe reopening plan. Those safe reopening plans need to be modified so that they actually indicate exactly how you're going to meet those certain percentages. I know that's tough to do, but we see it all the time at certain places where you go in a store and you're being clicked in and you clicked out a store. So that'll be the first thing that we have to do in regards to that. The other thing that I would add is that this is a team effort. I mean, really, absolutely, it's the owners and the hosts, the organizers that really have to mandate these requirements. They have to stick to them. They have to enforce them. And we will do the same with respect to our compliance teams. We'll get out there. We get out there by invite. We're out there quite frequently all over to try to take a look and enforce where we can. But remember, we're out there to educate and basically encourage to do the right thing. So those will be our plans right now. But again, the safe reopening plans, you need to modify those and express on those plans how you're going to adhere to the requirements that came out with the state. I hope that answers the question. If not, I can handle a follow-up.
Our last caller is from Colleen Shelby with the Los Angeles Times.
Hi, thanks for taking my question. I'm just wondering, as the only county in Southern California that's on this Tier 2, do you have any concerns that residents from other counties might flock to yours to kind of utilize some of these indoor activities that they have not been able to utilize in the past month or so? And also wondering if the state's updated assessment of the county on this week-by-week level will affect anything at the county level, or will you still be looking at trend data on a day-to-day basis?
Thank you for those questions. When I saw the map, that was the first thing that came into my thought process, is that the surrounding individuals from surrounding counties may be coming to San Diego. So we are concerned. We're concerned across the board. While we welcome the opportunity to relook at how we are managing this across the state, we are definitely concerned with opening up. But the good news is that we're opening up at a percentage of capacity. So we hope that, as Mr. Johnston said, everyone really is involved in making sure that we are successful. And as evidenced by the fact that we were red, and every other county around us, as particularly in the southern, the latter half of the bottom half of the county, speaks volumes to the team effort, the individual efforts, businesses, but people are and businesses have been impacted. So we want them to proceed with the recommendations, but also it says with modifications, and those modifications include the best strategies, best practice strategies that we've been talking about every day since this pandemic started. Now, I forgot the other question that you had. Can you repeat that?
Sure. I was just wondering if the fact that the state is now going to be assessing the data on a week-by-week basis, if that is going to change anything for local officials in the county, or if you'll continue to look at that data day by day.
We will continue to monitor not just the two metrics that we spoke about today, and that will be part of the monitoring metric for all of the counties, but we will continue to look at other metrics, those in our triggers dashboard, as well as the metrics that have been included in the past monitoring list. So we will continue. It will not impact us from a negative perspective, but we may have to adjust in providing information, say, for instance, stratifying that information by municipality. That's another factor.
And Dr. Wooten, I have two text questions. One is from Abby Alford with CBS 8. She says, tonight Saturate OC is having a church service in Oceanside. Their events in Orange County have drawn massive crowds. Last month, a massive church gathering in Cardiff drew concerns for public health. Is the county aware of this, and will you comment about it, and whether any enforcement will be made ahead of the event, during, or after the event? And if so, what type of enforcement will be made?
A lot of questions, but I would like to ask Gary Johnston to come back to the mic, and he can elucidate and provide information regarding those questions. Thank you.
Again, thank you, Dr. Wooten. First to the question, yes, we have become aware of Saturate and the planned activity in Oceanside. The county has established a safe reopening compliance team. It's a program with multiple teams that we have that coordinate and work alongside our other jurisdictions. Specifically, we have reached out to Oceanside, and we've been working with Oceanside officials. In particular, we will be at the venue this evening. We've attempted to contact Saturate through multiple different means and have not been able to reach them, which is unfortunate. However, our teams will be out there, and the things that we do, and we've done this before in previous venues across the jurisdictions, we will go out there prior to the event, and we will basically move out there with local law enforcement and other officials to basically do some education and some engagement. It's worked out pretty well for us in the past. We're going to try that again this evening. And really, we're just asking everybody that plans on participating to do the right thing. That's especially important with face coverings and physical distancing. If these are done well, it'll go much better. So we hope for the best. And again, that's our plan right now, unless there's any other questions. Thank you.
Wait, there is one more.
Okay.
This question is from Deborah Brennan from the San Diego Union Tribune. She asks, will the new state and county guidelines permit Legoland to open?
I mean, the first thing I would like to say is, like all of us, we're looking at all of this guidance right now, and so I don't really want to comment exactly on what came out because there's pages of updated guidance. I have personally worked very closely with Legoland, and I will just tell you they have an absolute fantastic plan to reopen when the state basically authorizes it. When the state authorizes theme parks to reopen, Legoland will be one of the ones that's ready to go. So that's the best I can do to answer that question at this time.
Okay, thank you. I have one more question, actually, from Anthony Pura from ABC 10 News. I think this might be for Dr. Wooten. Last time we reopened indoor services under similar circumstance, there was a spike in numbers. I understand it's a new system, but a lot of this depends on people's behavior. What do you think or hope will be different in this time?
I'll start, or do you want me? I'll start because I obviously do a lot of this, and I'm also on the compliance team. We have said this over and over again, that really it is a team effort down from the organization, the entity, the industry, the business, the schools, down to the individual, that if we collectively do the right thing, we will stay in the red and hopefully actually move to the right to orange. And so that's really it, and it's the big fours we've talked about. You know, we talk about screening, making sure that we're healthy people. We talk about making sure that we have good hygiene practices and sanitation protocols in place everywhere across the county. We talk about the face coverings, and we talk about the physical distancing. If we do those things routinely at the industry level all the way down to the individual level, this county will continue to be the shining light that it is across the state with respect to our ability to balance public health and safety with socioeconomic reopening. So with that, I'll turn it over to Dr. Wooten for any more comments on that. Thank you.
Thank you, Gary. I just wanted to simply add that last time when we reopened, it was pretty much 100%, with the exception of 50% of capacity for movie theaters and places of worship. This time, what we hope will happen, but it relies on people's behavior, is that as we are opening up 25% or 50% of capacity, not a full 100%, as we see issues, people should also be clear that we will shut down entities if they are not following the guidelines and if there are particularly outbreaks occurring as a result of not following those non-pharmaceutical strategies. So that's, and I always say hope is not a strategy, so we can't just hope. We have to ensure that everything that Mr. Johnston said in terms of all of the entities being involved, and our governments being involved to help ensure that we do everything to implement these strategies and ensure that people are behaving the way that they should to help control the spread of COVID-19. Thank you.
Thank you.
So that's our last question, and I'd like to thank everyone for attending today, and we just want to let everyone know that that concludes our briefing for today. We'll see you on Monday at our regular time at 2:30 p.m. Thank you.